There is growing concern around the rising cases of measles amongst children in the country. In fact, according to data which was released by the US Center for Disease Control and Prevention (CDC), India has reported the highest number of measles cases in the world between April and September 2022. And the latest news is that the centre is dispatching a multidisciplinary team to Jharkhand, Gujarat and Kerala to investigate some cases of measles reported from cities such as Ranchi, Ahmedabad as well as Malappuram. Maharashtra too has become a concern with over 500 cases reported this year, over 200 cases in the city of Mumbai itself with over 10 fatalities, the latest an 8-month-old boy. So what is resulting in the outbreak, what are the symptoms and what can one do to prevent it? First, what is measles? Measles is a viral respiratory illness generally presenting with a red blotchy rash, especially in children. It can be serious for children, but it is preventable by a vaccine. The disease spreads through the air by respiratory droplets produced from coughing, sneezing, etc. Symptoms can appear around 10 to 14 days after exposure as well. The virus is transmitted by direct contact with infectious droplets or by airborne spread when an infected person breathes, coughs or sneezes. Measles virus can remain infectious in the air for up to 2 hours after an infected person even leaves the area. The measles outbreak, according to doctors, is mainly occurring in unvaccinated children. This is likely due to low vaccine coverage in certain pockets, a repercussion of COVID-19 restrictions where many children miss their regular vaccine shots. In fact, a WHO report states that nearly 40 million children are dangerously susceptible to a growing measles threat. In 2021, a record high of nearly 40 million children missed a measles vaccine dose. And how critical is vaccinating against measles? The effectiveness of one dose of measles containing vaccine in children is 95% and 96% after 2 doses. Global measles vaccines are estimated to have prevented more than 25 million deaths from 2000 to 2019. A few things to remember about the measles outbreak. Ask your pediatrician if your child's measles vaccines have been taken or are updated. Generally, the vaccines are given at 9 months and 15 months and then a booster at 5 years. Doctors might ask you to prepone your vaccine to 6 months versus 9 months and 4 years instead of 5 years. Ask your pediatrician if your child needs to take an additional dose. Pediatricians are recommending to stay away from the following: sick children presenting with any kind of symptoms, fever, rash, coughs and colds. Heavily crowded areas which could potentially have sick children, such as public parks, crowded birthday parties, play areas. Maintain basic hygiene habits such as washing hands. What are the symptoms of measles? It can vary. It presents from, say, rash, fever, coughs to colds. And how does it present? It can present with a fever, sometimes high grade, along with viral symptoms such as even loose motions, coughs, colds, stomach aches. The rash, which is generally blotchy and red, emerges generally around the scalp, then behind the ear. 3 to 5 days, the rash is likely to spread to the entire body and will take another additional 3 to 5 days to subside. Children with vaccinations are likely to present with much milder symptoms. However, a key complication can be pneumonia and respiratory distress. This is much more serious in unvaccinated children and needs to be addressed immediately by a doctor or hospital. For vaccinated children, a complication such as pneumonia is expected to be much milder and rarely life-threatening. If your child does have symptoms, check with your doctor and isolate your child from vulnerable siblings as well as the elderly. How is measles treated? First, consult your doctor for treatment as it depends on the severity. Treatment is generally symptomatic, no specific medicine or treatment for it, say doctors. Doctors point out that it is prudent, however, to monitor the symptoms and take your child to the doctor or hospital if symptoms worsen or persist.